Right. Hi. I'm Dr. Samson Misango. I'm the head of surgery at Kiambu Level 5 Hospital. I'm also the program director of the COSEXA program, that is the College of Surgeons of East and Central Africa here in Kiambu, and a private doctor working at my own medical center in Nairobi called the Medical Surgery and Urology Center. Now, the aspect of global surgery as understood by me, I'll be very honest. Initially, I've not even thought about global surgery. But as an idea and a concept, I'll be able to break it down into three ways according to how I experience it. Because my understanding of global surgery should be something that I can be able to look at as a practice of surgery as I do it, and I compare it how other people do it in other parts of the country and other parts of the world, apart from here in Kenya or even in Africa and other places. For instance, um, I practice medicine in private hospitals, or I do surgery in Kiambu Hospital. I do surgery in a private hospital in Nairobi, and I also get a chance to go out of the country and do surgery in a hospital in Tanzania. We have very different ways that we handle the cases. The practice of surgery basics are the same, but the applications totally different. I want to do, for example, since I'm a urologist, I will look at it when I have to do a case in a hospital here in Kiambu. I take, for example, I want to remove a stone from the ureter of a young person. When I have to do it here in Kiambu Hospital, I have to do an open procedure. So I have to cut the patient and remove the stone. If I have the same patient in my private clinic in Nairobi, what I will do is, if the stone is in the ureter of a patient, I'm going to do lithotripsy, which is endoscopic. Now, if I am in Tanzania, now it depends on whether I'm in the rural setup or in the city setup. So I will do either open or close. Now, when I interact with my colleagues out of the country, they have all these novel ways of doing procedures. Okay, so my understanding of global surgery is to try and fit so that there is no what I can call the ideal way of doing something. What matters is the concept of, do you have the basics of the surgery? Do you know what it is you want to achieve? Do I get the result that I want to achieve? And does the patient go home feeling okay? Okay, so it has been for a long time we have been used to this idea that something that is coming from the West has to be the one that is going to be applied for the best result. But in my experience, I've actually found out that we have to use different practices in different places to be able to achieve the best results. And that is basically what I would like to just give as my perspective on this global surgery. So there's nothing like the ideal way of doing something according to somebody's recommendations from somewhere. It has to be according to them in their setup and what works best. Yes. Fine. Now, having said what I just said about the different perspectives from different areas, now we try to standardize our training for surgeons so that the surgeon can fit in any environment. To this end, we have this College of Surgeons of East, Central, and Southern Africa, COSEXA, and we have a training site here in Kiambu Hospital. I am the program director. So we bring in two students every year. Our current crop of students now is in their third year. So what we try to do is recognizing that we have different places or we have different practices that can be applied in different places, centers, but at the same time we want to produce a person with a global, should we put it, a global understanding of what should happen where. So what we do with our students, they go through our I can call it the basic training in our hospital, where we teach them with the facilities that we have available. Then we have an exchange program with different institutions in Kenya, like Kijabo Hospital, Tenwe Hospital, and the other areas in Kenya, because we are all in a developing country, but we are very different in terms of equipment and skills. Now, at the same time, what this should be able to get the students to understand from a surgeon's perspective is you will have the basic skills, but your applications will be different depending on where you are. But you should be able to fit in. So we try to fit them in that, number one, having those exchange programs. The other thing that we do for the students who are here for COSEXA is we try to get as many foreign faculty as possible to have a chance to be able to interact with us and the students. So somebody will come from, for instance, Tenwick, or somebody we've had last time a plastic surgeon from the US, right? So they come with the equipment and their own skills, and they stay with us for a week doing what we call surgical camps. It may be in plastic and reconstructive surgery, it could be in urology, it could be in laparoscopic surgery. Okay, so when they stay with us for 1 week, then our students and also ourselves as the faculty get to see how things are done differently in different places. And we may not apply those practices here, but they remain in our students' memory, so that when they go somewhere else, they are not completely like thrown into the deep end. Okay, so that's how we work out. Now, during the training, the students get to do a standardized exam. A standardized exam means basically that what the student is learning here in Kenya and the student learning in Zimbabwe or Malawi, eventually when you have one exit examination, it kind of puts them at par. And there's also a collaboration with one of the people who, one of the institutions that have been very instrumental in developing the COSEXA program in Africa. That is, I think, Edinburgh and some islands. I remember, I forget the name of the university, the colleges. But this collaboration ensures that we have a constant influx of new practices, new skills, new knowledge that we use to teach our students in a syllabus that culminates in their being awarded a fellowship in surgery. So these are some of the things that we can say help us to fit into this global surgery concept, which in my mind is a good idea, but still it's a concept in development. Yes. Now, as a follow-up to our training and what it is we want to expose our students to in terms of global surgery, we have some challenges. I can call them challenges because we are practicing surgery in some very rural areas. Sometimes actually we lack in some very basic things which are considered straightforward basic setups in maybe Europe. So, for example, we had this plastic surgeon who was coming to pursue areas of collaboration between our college and his institution. Okay, and he comes and he has a look at our environment, and to cut a long story short, he decides that our setup has got some challenges which is a bit difficult for him to overcome. Now, this fellow will be around here for maybe 1 week because he has to make his tour coincide with his holiday season. Because he's on holiday climbing Mount Kilimanjaro, he has to go through Tanzania, come through Kenya, go and see what's happening on the Mara, and that's okay. They are entitled to have their time. But then they fit us in and we appreciate into their program. Then what happens is he extends his tour on other institutions around Kenya. and decides that he's going to work with an institution that has got better equipment or better position to serve his needs. Now, that goes counter to what we're trying to achieve with global surgery, because the people who are in our institution end up continually being marginalized. We can call it, it's like when you're trying to allocate resources and you keep on saying, we'll keep on allocating resources to places which are able to do 1, 2, 3, 4, 5. So the areas that have been marginalized continue remaining marginalized, and that has been the story of our developing country for many years since colonialism. Because areas that were marginalized because they're not productive continue being marginalized, and the areas that are productive continue producing more because that is where people are putting in more resources. So I would wish to have in this global surgery concept, our thinking changing a bit, so that we focus more on areas that are got less resources, and that way we at least elevate them up. And instead of, because the idea is not to create a good environment for somebody who is visiting, but for the person who is visiting to try and uplift the standards. Yes.